Second one. Third. Okay, that's fine.
Minister, my name is Koskona Duma. I'm from Eyewitness News. Minister, maybe let me start here. There is some confusion about the wearing of masks. Some are saying that COVID-19 is airborne, and others are saying it's not. Others are saying that the masks actually exacerbate the risk of you actually getting infected. Can you please just give the country guidance in regard to the safe secrets? Minister, now that this virus has arrived in densely populated areas such as Khayelitsha, as we now know, how is that program that the national government is planning to implement of actually opening up some public works buildings to actually host some of the people who are positive and those who may need to self-isolate? And just lastly on my part for now, this lockdown, you previously indicated that we might have to wait a bit before actually seeing the results of it. Can you just please give an indication of when we may see the results of this particular lockdown? And just lastly, what in your view would inform the extension of the lockdown if it gets to that point? Thank you.
Thank you. Second question.
Sita Mabusa from Independent Media. Just 2 questions. Minister, we've already told us that there is pressure on our laboratories. Do you have a plan to ensure that the mass testing that is about to take place doesn't put more pressure on those labs? Secondly, can you confirm a case that is reported in Umlazi? Yes.
Okay.
Mr. Oren from the Sunday Times, just confirmation, just clarity on the number of deaths. Understood you to have said 5, but I believe it's 5. It is stands at 5. Just clarity, if you could clarify that for us. And then certain allegations, Minister, had made by nurses around the country, saying that initially they were informed by the Department of Health that if they had to deal with patients related to the virus, they would have to be quarantined and isolated somewhere, with either in the hospital or somewhere around the country, but they're being sent home. So we've received those allegations from certain nurses. There was also an incident in Valcom at the Bongani Regional Hospital. I'm not sure if you're aware of that, Minister, where action had to be taken against nurses who had gathered and were protesting regarding not having sufficient safety gear to treat patients and resources. And then just a quick one, Minister, regarding temporary structures. Would the Department of Health be considering, or would they consider temporary structures being erected? We've seen it happen in China and Russia. There have been a number of private companies that have come forward to say that they can put up temporary structures in as quick as 12 days in the country. So just want to know if the department is exploring that aspect.
Thanks. Those were the 3 hands that we had. Minister, I'll take the question that was talking to Public Works, because I think that relates to the province.
Okay. Sure.
As part of the planning.
You want to come and sit here?
Oh, okay. I can stand, Minister. Don't have to stand. Okay. No, thank you. I thought that I needed to respond to the question that relates to Public Works, because that talks to our planning as a province of KwaZulu-Natal. Of course, you know, we hope for the best but plan for the worst. And as part of our planning for the worst, we decided that we needed to identify bigger spaces where, should need arise, we are able to accommodate the big numbers that we might have to face if that comes, if that situation comes about. Now, what we decided to do is to identify not just Public Works but all buildings that are owned by government in the province of KwaZulu-Natal. Of course, you would know that those buildings would then be under the asset register of Public Works, and we are working towards identifying those. In identifying those buildings, and I think I need to be specific here because there has been some confusion. Some of the buildings that we are looking at is schools that used to be utilized previously but are no longer in use. We are not going to be looking at schools that are being used currently. So we've got quite a few schools that the Department of Education had handed back to government and said we are no longer utilizing these facilities due to a number of reasons, because the children are no longer viable, and we call them non-viable schools, and that had to be closed down. So we are looking at that, but we are not just looking at schools. We are looking at government buildings themselves, including the buildings in the city center, buildings in eThekwini, buildings in Gundlovu. In fact, we are looking all over the province, but we've not stopped there. We've also looked at facilities that are owned by government, where these are owned by agencies of government, where are being utilized, and we have enough beds that we could use. So that is a program that we have in place. Next week, when we meet as the Executive Council and we have a proper plan that has been tied up, we will then be able to announce. You will remember that in our reporting, it is some of the things that we have been reporting to say we've identified a number of hospitals. However, we are also looking at ensuring that we use some of these beds. I must also indicate, Minister, that we have had a number of offers from the private sector, in particular, some donating buildings, some saying, look, we are hotels and we are not getting any business right now. You could use some of our facilities, and we are having those engagements all over the province. So the bottom line is that we will be using whatever beds that are available as soon as we need them. Thank you, Minister. I think that's the only one that was relating to the province.
Yeah, may I apologize? I think a bit of confusion as I was trying to give you the specific. I want to say, deal with this issue of deaths again. It's 5 deaths. Okay, the first one was in Western Cape, a 48-year-old lady who had an underlying problem of thrombosis and embolism, and that we reported already. The other one was in Free State. Okay, the other one was in Free State, 85-year-old male who was part of the church, original church where a number of people got infected from. He was admitted over the weekend and also passed away. The other one is in Gauteng. This one was a gentleman that had also no history of travel, but had been in Cape Town and was around Krugersdorp, and he was admitted with respiratory distress, and therefore he succumbed yesterday or 2 days ago. Then there are 2 in KwaZulu-Natal. One is a 74-year-old male in Ladysmith, who we reported already. Then there's a 46-year-old lady who had chronic asthma and hypertension. That's the one that I think you might be reporting, who came from Mlazi. That's the one. The other issue you asked us about was the use of masks. There is no question about the fact that the masks are actually one of the best ways of preventing spread of the infection, and we would recommend them in particular where people have got any cough or any symptoms, or in a situation where social distance is a bit difficult, so to make sure that people can use those masks where possible. So the issue of COVID-19 being an airborne infection is actually something that came out in the papers, but WHO did dispute that. As far as we are aware, it's a droplet infection, which means that it's got a risk of spreading to people who are in close proximity within a meter, and therefore, and those where there could have been droplets that would have fallen to the surfaces that are being used, in which case between 9 to 12 hours they could still be available, they could still be viable to actually cause infection. Then, of course, it means that you might also be in clothes and so on, you might have that problem. So as far as we are concerned, yes, masks are still very useful. They are just one thing that I think we must actually use as much as is possible. So I don't want us to have any doubt, whatever might have been said, but we shouldn't have any doubts about the fact that masks are actually useful and recommended. How long do we see the lockdown for? I don't think that anyone can say that. Right now we have got 3 weeks. It's the 3 weeks during which we need to be able to deal with the effort to reduce the rate of the spread of the infection. Thereafter, we're going to be assessing on a day-to-day basis. We're going to be assessing as we get closer to that time. Obviously, I think we will not have life as normal after the 21 days. There has to be adjustment in the way we behave ourselves, in the way we do things. There has to be adjustment. I think many countries have had to track for several months before they saw a change. Some countries still haven't seen a change. But there are a few countries that have been very exemplary for me as I've been looking around. One is China, which despite the huge load, burden of infection, they were able to actually contain this, such that today China is number 4 in the world, when in fact it was number 1 with anything, with no country anywhere close to 5,000-10,000 for a number of weeks. Today China is actually becoming the one of the ones that's got the smallest number. I think China is number 4 now, with the US, with Italy, with Spain, and so on, really raging ahead. So anything can happen to any country. I think we need to be aware of that. The other country that I found to be very impressive is South Korea. South Korea was the second largest country in terms of the spread of the infection at the beginning, and so right now it's dropped to number 13 if you compare the countries in the world. That means that you can do something and actually have an impact. But I think amongst those issues is a change of behavior, social distancing, and also use of masks, and also people really following the guide that this is going to cause infection, let's avoid this, and so on. I think that has been a very good lesson. So whatever happens after the 21 days, we must know that our behavior has to change completely. And this idea of people sending around fake news and telling people about stories that this infection doesn't affect black people, it's only for white people, is wrong. It's not true. That noise for rich people, if you are poor, it doesn't affect you. Again, it's not true. That it will not affect you if you don't live in a suburb, and all of that is not true. I think people must stop believing in fake news and believing in things that are going to make it difficult to manage the infection. What I think is important is for us to always take seriously when there's an infection. In this case, we also want to warn people that if you are advised to stay home and be in quarantine, you need to accept that. We've actually had to charge a number of people for not adhering to the quarantine. I was just talking to the MEC and the Premier here, were telling me about how, since we have said everyone, even if you are in a hotel, you must stay in quarantine, they suddenly found in one hotel, when people were normal tourists visiting the country, enjoying themselves, they found that 12 of them actually have just tested positive. Now, if they'd been moving around, they would have been obviously have affected other people. But they listened, they sat there. Now we will wait for the 14 days, they'll burn the virus out, they'll be treated and everything, and things will be fine. So I think it's important for us to know. It's really more important as we move towards the winter days, because then the impact of the viral infections, all sorts, is going to be heavy on all of us. So we need to therefore understand that all these precautions are actually helping us to get ready for the time when, without COVID-19, we would be having a problem of influenza, flus and colds and sneezing and coughs. All of that, when now there's on top of it some COVID-19 infection on top, it makes it more complicated. So I think it's important for us to understand that when we were asked to stay at home, it was for the good of the nation. When we were asked to stay at home, it was to reduce the infection. In fact, as I said, our modeling is already indicating that maybe we can actually make an impact. So it's still early, as I said. I don't want us to spend too much time on it, but just to say that if we can stick to the guidelines that have been given, we would be able to actually make an impact on the infection. We need to chart our own history. We need to chart our own conduct of how this whole viral infection has been dealt with. It will not be the same as all other countries, but it can be very different if we actually think we're just going to be carefree about it. But if we take all the lessons from the other countries will be able to make a huge impact. And that's why, for me, it's important for us to make that plea to our people. Now, the question about the pressure on the laboratories. At the moment, a few months ago, if you ask for a COVID-19 test, it would take 2 days, 4 days, and so on. Now it's much more rapid. We've increased the capacity. We've created more equipment. We've found more equipment to be able to create capacity that allows us to test as many people. If you look at the numbers we're testing now, we're able now from late last week to be able to test up to 3,000 to 3,000 tests in a day. So that's why, for example, last Friday, we could say that it was possible to clear a backlog of 4,000 tests that were actually stuck. So our capacity is improving. We're not worried about that. We believe that we're going to be improving the capacity as we move on. That's the one aspect. The other aspect is that these rapid test kits, we also want to use those as well to add on our own capacity. Now, these two are interesting because for a while we didn't want to use the rapid kit test. We're not under that pressure. But also the challenge with those tests, it's important for us to get the consensus amongst all our clinicians and academics so that we can actually use them in the same way, because the way the tests work is not the same. The first one that we're doing, which we're using, which we call the PCR test, those tests basically pick up the presence of the viral particles, so they are able to show you an active disease. Some of those rapid kit tests are showing what we call antibodies in the body. They actually show the body's response to the fighting the virus, which means it can be positive now, but we might have finished fighting the virus and so on. But that's not a big issue. Those are issues which clinicians and academics and researchers can worry about. In our case, if that's going to help us to be able to scale up the testing, we're happy to move on with that. So we're hoping that all of these issues will help us to be able to get registered kits, rapid test kits, which we can actually use inside the country. So all of that is something that's on course as we speak now. The other issue you raised about nurses who are making allegations, I think it helps if we just get direct allegations so we can investigate them, because if nurses have a concern about safety gear, I think the management needs to address that, and we must really be upfront with that. Anyone who needs to have the right gear needs to be assisted so that they don't get exposed. So it's in our interest for our nurses to be well protected, because they are our force in the fighting against the infection. I'm not aware of the details of the Velcom situation that's been asked about, but I can check that and find out what happened in that kind of situation. Except that we must just say that any health worker that raises a concern around the safety gear, protective gear, I think they are entitled to that request. So it's something that we must just address and talk about. If there are delays, what are the delays, for how long, and what can be done in the meantime to make sure that their situation does not get to be worsened. The question of temporary structures, well, we can't rule out anything. Our first point right now is to go for existing buildings where we can utilize the buildings to utilize them for extra beds, where we need to be able to locate extra beds. That's been done in every province, and we've said right for up to every district there must be centers where we are able to get extra beds to admit other people. Also, if we need to scale up the numbers of beds, we're already looking at bigger sites where such beds can be accommodated, where we can accommodate 1,800, 1,000, up to 2,000 beds and so on. We're looking at those options. Those are things that are part of the plans. We won't announce it until something concrete has been done there, but we're actually advancing looking at all those issues. The reality is, as MEC was saying, we haven't admitted many patients. The last I checked, we had about 55 or so patients were admitted. most of the people were not needing to be admitted. However, we want to always be ready ahead of the outbursts. If the viral infection were to in any way increase, then we must be ready to be able to manage those kinds of situations. That is why you would have heard that there's been talks about also increasing the numbers of ventilators that are available, where we've had a discussion with the medical device manufacturers to say we need them to already start building up an additional stock of ventilators just in case we need them. We don't want to be caught unawares. We want to be ready ahead of time, and we want to say that as we see the disease progress, we'll be trying our best to try and reduce the rate of spread, but at the same time we'll be preparing in the event that the numbers of people that need to be hospitalized is increased, that we must find ourselves ready to be able to deal with that situation. But again, we have got a lot of support from private sector, from non-governmental organizations, from communities. People are coming forth to say, what can we do? We believe that's a very good spirit to be able to fight this kind of virus, so that all of us must know we're in it together. This is not coronavirus is not going to be a battle that's going to be fought by the nurses and the doctors. It's a battle that's going to be fought by individuals, by communities, by families, by society at large. It's important, therefore, for us to be able to say, when we deal with this issue, we're dealing with it with the understanding that it's about saving our nation. It's about saving each and every one of us, so that we should not lose anyone as a result of this infection. That, for us, is what we would like to be able to send as a message across. That for those who find that there are challenges with the lockdown, please bear with us. We're really doing it for the best of our country. We do understand that there are challenges in a number of areas. What President and Cabinet has insisted on is that we need to make sure that essential services, particularly food, should be available to our people. So people must not be dying of hunger while we're trying to fight the disease. People must be able to reach out to where they need, excuse me, to where they can get food, so to where they can get essential services. It's important for us to remain open and flexible for that. Thank you very much.
Thank you very much, Minister. Just one last round, colleagues. Okay, I'll start with Spamandla. Is there a follow-up?
Yes.
No. Okay, wait. I'll start with Spamandla. You'll be the second one. 3, 4, 5. Those are the last heads, ne? Okay.
In the Free State, Minister, how far have you gone with the tracing of all those who attended that church service? When you addressed the South African Medical Association in Pretoria, you said you were in favor of drive-by testing in densely populated areas. Do these mobile vans you talk about form part of that? And also, if you can give us a breakdown of the health workers that will be doing these massive or mass screenings and testings, please. Thank you very much.
Thank you, MEC. This is just a follow-up. Perhaps you can also check in MEC. It's just a follow-up on the number of beds that are already available, because you do say there's many people are offering you, but can you just give the country a figure? Also, I understand that, Minister, that the country is in the process of developing its own testing kits. Can you give us an update about that? Are we already in motion in that regard? If so, also can you help us with figures in that regard? Thank you.
Mr. Heights, Kabil Singh from News 24. You've indicated the mobile sort of testing that's going to be rolling out in a mass scale in just a few days, which is excellent. Can you indicate, right now you said there's 39,500 people that have been tested. What's your target for the mobile testing in terms of the amount of people that you want to reach? And what sort of measures will be taken to protect the healthcare workers on the ground that will be conducting these tests? Thank you.
Minister, it's Kayleen Pillay from the Mercury newspaper. Just talking about the MSC cruises, there's now 2 cruises where 2 passengers have been tested positive. On these cruises, there's more than 3,000 people that go on these cruises. Are we potentially looking for more than 6,000 people that may have come into contact with these two passengers on two separate cruises. How are we handling that? And do we have have we made contact with all these passengers? The second question is, we are looking at mobile teams going out to various townships and hotspots. Which are the hotspots here in KZN?
Nushira Sudyal from East Coast Radio Newswatch. I just would like to know, Minister, you spoke about people who were directed to go into quarantine after testing positive, but don't do that. How many people, if you do know, have been arrested because they actually didn't take the orders and walked around, and how many people have they come into contact with? Can you give us a breakdown of those cases? Also, you spoke about deaths earlier, Minister. You said 5 and then you went back to 4 and then they're back at 5, I think. But I want to know the Lazi woman who would be potentially the 5th person. Do you have more details on her, and is she confirmed at this stage?
That's the last.
Okay. Thank you very much. Let's start with the last question. This is an unfortunate death that's happened a few hours ago, and we do wish to convey our condolences to the. In terms of our report, she is a 49-year-old lady who's so the 46-year-old lady who was admitted with hypertension and chronic asthma, and then tested positive in the process. So that one, as far as we would be aware, that's the information we have, and we believe that's confirmed. And so the number is 5. I did have a bit of a quibble at some point, but that was just an error. The number is 5. As I did say, the number, I actually went through the whole breakdown. The 46-year-old lady in Durban, then there was also a 74-year-old in Ladysmith, we reported already previously. There was a 79-year-old in Gauteng. We had not reported that one. We're reporting that one for the first time at this point. Then there's another one who's 85-year-old in the Free State. That was reported by the President yesterday. Then there's a 48-year-old who was in Cape Town, Western Cape. So those are the numbers that we have. Those are confirmed. Then the question is, how many people have broken the law? It's difficult to remember everyone. We didn't count, but you might be aware there was someone was charged in Ladysmith for attempted murder. There was one that the Gauteng MEC went to court to actually enforce the quarantine. There is the one that I think MEC has also had one in St. Lucia, who was informed in Kruger National Park that he was positive. He continued to drive all the way and came to St. Lucia, and then they were just about to embark on a boat. They were stopped, and then that one was charged. The other ones, we didn't charge them, but what happened was they moved from Kruger Park and came to Maritzburg, got tested, and then instead of waiting for the results in quarantine, they drove further to the Eastern Cape. But what we then did, we then got the health authorities and police to go and wait outside that hotel, and actually asked that nobody must leave that hotel, and they were left in there. They were now in the hotel, and so that's the number that you can think about. I'm sure there are a few others, just that we didn't take note of them to be able to respond to you in that way. And then around Free State, I'll have to open up to check for you how many contacts have been traced in the Free State. The last were checked, there were close to, I think, 1,400 that they traced, but I will just double check and make sure I've got the correct number for you. But the issue of drive-by testing, it was an important addition to the approach to increasing our testing capability. So that will still be part of it. When we talk about mobile van, we are looking at, firstly, the vans that are going to go out. Then we will then be able to set up sites where we'll say people can come past and test. As our numbers of vans increase, we'll be able to do that. So that's still pretty much part of our strategy. The health workers, now to do these tests, the doctors have to do the swabs. In this case, we get the doctors to do the swabs. For some of the test kits, some of the rapid test kits will actually be using nurses and doctors, so it will be done by professionals. The question of protection, they have a known gear that they'll be able to have when they do the test. They'll have the full gear that is used when people are doing. Because when you test anyone for coronavirus, you assume they've got it, and so you treat yourself as though you're protecting yourself against someone who's already confirmed. Then, look, the numbers of beds at the government level, we've got just about 87,000 beds around. Obviously, for purposes of COVID-19, we've got, we've identified the number of hospitals. The numbers of beds, we would have to add them up because we keep increasing them as we move. Originally, we just counted the number of hospitals, but now we have said they must now be counted in each and every district, so that we know, how, if even up to a point of small towns now must look for space where we can potentially be able to put beds. Sometimes even if they're not there, but they should be possible to deploy within a very short space of time if the situation arises. We're not manufacturing our own kits, rapid test kits. However, there are a number of options that we're looking at. The first lot that I spoke about, the rapid test kits, are the type that we say, that I said is about checking for antibodies, which is, there are a number of countries that have got these kits. We're wanting to validate them and make sure that we get the most credible, and therefore we'll get them out. Those are the ones that we're going to use in addition. But as we're going about with these rapid tests, these mobile testing, we're still using the same tests, which is what the 39,000 that I spoke about, which are throat swabs that you do PCR on. So those will still be the ones we use. Then once we get to increase the rapid test kits, we'll then be explaining the approach, because that will use a slightly different one. There's another type of test that we are also exploring, and that is what is called GeneXpert. Now, GeneXpert is the same equipment that is used for testing tuberculosis. It's fairly sensitive, and it also works very within a very short space of time, about 45 minutes, you will get your results back. And it's already using the same type of equipment that's available. However, because it has not been properly validated and properly registered, we're not there yet. So once it's sorted out, we can talk about it. But just to say, in case what you're referring to is that question, I'm just responding to that. Then, okay, the issue of the cruises. When we got the first patients, we did follow up. But what we're now doing, because we have been going back to try and look at the records, we want to just make sure that nobody is left behind. We just want people to come out and say, if you have not been seen and you have been part of that cruise, just show yourself up. That's really what we're trying to do. And the MSC Cruise Liner is a reputable company. They've been out there, they've been very responsible for tourism and so on. But because of this new disease, we have actually discussed with them that they'll give us all the names. We'll then recheck and make sure that we didn't leave anyone outside there. It's still important to know if there's anyone, even if they might no longer have had symptoms, even if they may not have had the infection, we just need to be sure that you've covered our tracks. That's really why we're making the announcement at this point.
We agreed on the last round.
Just fake news. It didn't happen.
Wait. I'm not giving you.
Minister Nabila Sheikh from ETV News. Just one more question. Actually, I'll put them both together. So we've been
One more and two.
of another death in KZN. This was issued by the Islamic Burial Council in the Stanger area. They had issued it to the community as a notice because it was the first death that way it had to be handled in accordance with Islamic rites. So we haven't heard about this death from you. That death took place early this morning according to the statement that we had issued, and I've personally confirmed this with Zweli Mkhize of the council. The second is about the hotspot areas. Are these areas going to be made available for public knowledge so that people actually know where these hotspots are and they can avoid them?
Just one question, Kabazela. I hope you are going to help us. There are people who are saying there's a link between 5G and the coronavirus. What exactly can you say about that? Because it's out there, people are talking about it. What exactly can you tell the nation about that?
I'm glad to see they raised that because it is something that on social media is talking about.
Just in closing, the issue of these mass testings, how are you going to deal with the issue of criminals who will abuse this when they go to communities? I'm asking this in the context of a case in Pietermaritzburg, Sweetwaters, where a 76-year-old was raped and killed allegedly by people who posed as soldiers who were coming to houses to sanitize those houses or people. How are you going to deal with the element of criminality, working with the police, of course?
Thank you.
Sure. Well, it's going to be very difficult to deal with a situation where people begin to impersonate police. We can just make a call to say to our people that it's inhumane what has happened. That you can have someone being raped, someone walking into their house under the false pretenses is completely unacceptable. We condemn that, and we hope that the police will be able to find those people. I think that it's going to be important for us to make sure that the police and the soldiers are aware that whenever they get into the home states, they must be able to have the necessary identification and decorum to be able to make people to have the comfort that they're dealing with the real security forces. But it's very difficult to predict what criminals can do. So I think communities, when we find this out, we need to just work together to expose those kinds of elements and help the police to apprehend them and deal with them as soon as possible. It will really be a problem when people are going to fear to respond and respect security forces simply because there have been some who have actually impersonated the police. It's unacceptable and we condemn it. The other question raised 5G and COVID-19. I think we are dealing with a lot of fake news here. The reality is 5G is more a technology issue, and the COVID-19 is a real infection. It's an organic infection that's based on a living viral agent. It's not something that is you can link with any kind of technology, as it were. The form of spread is well described scientifically in terms of all the viral agents. The behavior is the same. It is well known. We have actually tracked this virus to say it comes from animals, and this was a zoonotic transmission from animals to human beings, which is what caused the problem. And it is not something that we must go around scaring people. We must tell them the real truth about it, that it is an infective agent, that you can prevent the spread, but it can be very serious as well if you don't take care of yourselves, and it can complicate, and it's something that you can fight and defeat, but it's something that we must have true information. So we need to use facts to fight coronavirus. We can't use fake news to fight coronavirus. If we actually believe in fake news or spread fake news, we're actually undermining the fight against coronavirus. The other question which was raised was the kind of contacts that have been traced. Okay, the Free State numbers, 1,619 contacts have been traced. 1,619. That takes the total of all the experiences of the Free State. Then, those were identified. 921 have been traced, and then they are finishing off the 698. Of those, there were specific in relation to the particular original church. There were 401 people that had to be tracked on that one. And out of that particular experience of that church, 31 people tested positive. Right now, the number in Free State had gone up to over 70, and of course, some of them were people who were leaders of the churches that they've now gone out to their own churches. So we're continuing to track that one. Then the one case that's been reported by the mosque, I'm going to check on that. I have not been alerted to that. If it happened this morning, obviously I'll still be able to get proper feedback, because not everything that would have happened today I would be able to have full knowledge of. But as soon as we get back to get the daily briefings, I'll be able to get all of that confirmed if that's the case. Then the hotspots, the value of the hotspots is not so much that people must avoid them. The value is that people who are in those areas must come forward for testing, so that you can actually find the virus wherever it might have spread, and make sure that we deal with all the people who might have been infected. It's not to say now run away from this particular place. There are people who are infected in various parts of the country. Doesn't mean you run away from that place. It basically means that if someone is in quarantine, they must stay in quarantine. If someone is actually taken out, for example, there will be those who will be in an area where it's difficult to ensure that they can have a quarantine in their own home because of the setting in which they are. We'll find a place for them to go to. After 2 weeks, they'll have to come back. Then we know that they are actually safe. So the idea is not to stigmatize an area or the people. The issue is to say, when we deal with a particular area, we're trying to clear the infections from the people who are in that area. We're not trying to make people to look at it and stigmatize it and fear it, as it were. So the approach, therefore, is that let's have a very compassionate approach in understanding this issue. We mustn't use an approach that makes people fear, run away, or stigmatize those who are infected. After a while, someone will be over the infection, and if you get an infection once, so far, after it's been cleared, you will not spread it to other people, and you may not get it from someone else. So we mustn't have someone where we say, well, he has had COVID-19, so don't get close to them. Once they are negative, they are negative. Once they are over the infection, they are over the infection. The real issue is that you need to worry about yourself. Aren't you going to get the infection and be the next one actually who's got the infection? So I think people must know this virus is going to be here with us, and we need to just make sure that we are compassionate to each other as we manage it. Thank you.
Thank you very much, Minister. Ladies and gentlemen, that is a wrap. I